Hi, and welcome to the ASMR pop-up vaccination clinic. My name is Nurse Evie, and I will be administering your COVID-19 vaccination today. How long were you waiting in line? Yes, I can imagine. Ever since the state opened up eligibility to all adults, it's been quite hectic over here. So thank you so much for being patient and waiting in that long line today. I have something that may make up for it. I see here that you've been randomly selected to receive a little additional monitoring following your COVID-19 vaccination today. And what that involves is a little bit more of a personalized experience, and it helps us to better understand the short-term effects of the COVID-19 vaccination, as well as contributing to the knowledge for long-term effects. Is this something that you think you'd be interested in? Wonderful, thank you so much. Well, if that's the case, I do just need to verbally confirm a few details, if that's okay. Okay, so the first here is, can you give me your first and last name? Okay. And the last name, can you spell that for me? Okay, wonderful. So the vaccine you will be receiving today is the Pfizer-BioNTech vaccine, which is authorized for people who are 16 and over. With that being said, can you please confirm your date of birth for me? Have you been experiencing any sort of feverish symptoms today? Okay. Okay. And have you ever been diagnosed with a bleeding disorder, or are you on blood thinning medications? Okay. And to your knowledge, are you immunocompromised in any way? Okay. And do you take any immunosuppressant drugs? Okay, wonderful. And I do have to ask this from everyone, but are you pregnant or planning on becoming pregnant? Okay. And are you currently breastfeeding? Okay. And have you received any other COVID vaccination? No? Good. So that's for your first dose today. And finally, have you ever had any sort of allergic reaction to a vaccine, whether it was mild or severe? Okay, good. All right, well, let me just make some additional notes, and we should be set. Let's see. Okay. Well, from the responses that you've given me today, it does seem as though you are eligible to receive your first dose of the Pfizer-BioNTech vaccination today. Before we begin, I do just want to give you some additional information about this vaccination. Unlike a traditional vaccine, this Pfizer vaccine does not use a dead or weakened form of the virus itself. So there is no possible way that you can catch COVID-19 from receiving today's vaccine. The way that this new technology works is that we inject the mRNA or the genetic material that your body needs in order to produce the spike protein that is on the outside of the coronavirus and actually gives it its name. It looks like spikes or a crown. And once your body receives that genetic information, it produces that spike protein. And even though your body is the one that created it, your immune system recognizes it as a foreign contaminant. So your body does activate your immune system in order to fight what it perceives as a foreign contaminant. Once your body learns how to do this on a low stress level, since it's not actually the virus itself, if it ever encounters the actual COVID-19 virus in your bloodstream, it will recognize that those spike proteins are bad, and it will attack them and destroy the virus. So it is quite effective, and it's a very exciting new development in vaccine technology. Do you have any questions for me? This is a really wonderful question. So, even though this vaccine just came out last year, the research behind mRNA vaccinations has been around for well over a decade. So, it's absolutely safe. That's another very good question. So, your body is actually really good at dissolving the mRNA information after it's done with it. So, it's not going to change your body's DNA in any way. These are really wonderful questions, and they're very important for you to be able to feel like you can ask these kinds of things of your care provider. So thank you so much for voicing your concerns. All right. So before you receive the vaccine, I do want to conduct a brief examination so that we can get some baseline readings on you. And then after you receive the vaccination, I will also conduct these tests just so that we can have information before and after. Does that sound good? Okay, wonderful, thank you. So first what I'm going to do is I'm going to put on my gloves so that we can be absolutely sanitary, and then we'll go ahead and get started, okay? Okay. So first, what I'm going to do is I'm going to examine your pupil reaction. So I'm going to use my handy dandy little light. And what I'm going to ask you to do, if it's okay, I'm going to scoot a little bit closer to you. Okay, is that all right? Okay, so what I'm going to ask you to do is pay close attention to the tip of my nose, or where you imagine the tip of my nose would be. I know it's hidden behind my mask, but just pay attention right here. And I'm going to shine this light into your eyes. It is going to be a little bright, okay? So don't worry. I'll try to be as gentle as possible and make sure it's not shining directly for too long, okay? So I'm going to go ahead and get started. And again, just focus on the tip of my nose, okay? Alright, now let's go to the other side. Okay. It's looking good. Looking good. Okay, wonderful. Well, both your pupils seem to be reacting quite nicely. Wonderful. So like I said, we'll bring back the light. I know it's very easy for your eyes to get teary after that, okay? So next what we're going to do is I am going to listen to your heartbeat. Okay. Alright, so let's take a listen to your heart. If you can please just move your shirt aside for me. It's gonna feel a little bit cold, okay? Alright, nice strong heartbeat there. I do hear that it's a little quick, but I'm sure you're just feeling a little bit nervous about receiving the vaccination, is that right? Yeah, I understand. Shots are always a little intimidating, even if you've received many of them before. But don't worry, I'm pretty notorious for having a very gentle hand when it comes to injections. So you are definitely in good hands, okay? So now we're going to move on to your lungs. I want to get a good listen to your lungs, and I'm just going to reach around you, okay? I promise I actually don't have COVID-19, and you've been tested and you don't. So I'm going to reach around you, and if you can just do me a favor and take a deep breath in a deep breath out. Another deep breath in. And you can breathe out. Alright. So now I'm gonna go and listen to the other lung, okay? So do me a favor and take a deep breath in. And out. And deep breath in. And out. Wonderful. Great. Everything sounds good. I always like doing the deep breaths at the end because they're really wonderful for calming people down before a vaccination. So I'm just going to make some notes about our exam, okay? These will help us at the end when I do the second examination. Okay. Don't worry, everything was normal. With that being said, we can get started with the vaccine itself. So let me go ahead and grab my tools. Alright, so here we have everything we'll need for today. First, I'm going to start with an alcohol swab just to disinfect the area that we're going to inject, okay? Alright, what I love about these particular alcohol swabs is that they're quite thick and cushy. Grab it from its packaging. Alright. Okay, so here I have, see, it's all nice and thick. So if you can just give me your arm. What's your dominant arm? Okay, it's typically best to do it on the opposite side. So, alright, here we go. Nice big area here. Just to be on the safe side. Alrighty. Now we're going to go in with the injection. The appropriate dose is 3 milliliters, so of course we're going to make sure that we are very precise about our dosing. Great. So, a little bit of an air bubble there, so of course we want to make sure that we get that out. We don't want to inject you with anything but the vaccine itself. Alright, so like I said, I am very gentle when it comes to vaccinations, so you shouldn't feel very much pain at all. You'll just feel a little sting, okay? Would you like me to count down for you so that you know when it's going to come? Or would you prefer to not know? Okay, you would prefer to know? Alright, that's no problem. Everyone prefers something different, so just go ahead. And I'm going to be injecting in 5, 4, 3, 2, 1. And that's it. That's it, right? Didn't feel so bad, right? Good, I'm glad. Alright, so let me just go ahead and grab you your Band-Aid. Here we have a little Band-Aid. I tend to prefer the clear looking ones, just because they're more inclusive. Okay, let's grab your Band-Aid. And here we go. Wonderful. Well, congratulations. You've now received your first dose of the Pfizer vaccine. You do have to wait a little while before you're able to go. We do have a recommended wait time just to keep an eye on you and make sure that you don't get sick, that you don't have any sort of adverse reaction. So, since I did conduct that that examination at the beginning, I want to give a little bit of time for the vaccine to course through your bloodstream just a little bit. So now what we can do is actually fill out your COVID-19 vaccination card. All right, so here is your COVID-19 vaccination card. Please make sure that you don't lose this. You will bring it back to the clinic in 3 weeks, 21 days, and you're going to get your second dose, okay? So I'm gonna go ahead and just fill it out for you. I have my notes here, so I don't need the spelling of your first and last name. I'll just go ahead and include those for you. Okay, and initial, date of birth, and then we're doing Pfizer today, not Moderna, that's Pfizer-BioNTech, and the number, today's date, healthcare, our clinic site, that's the ASMR pop-up vaccination clinic. Alright, so we filled out the beginning of your card. And in the back, again, it's very important that you return for your second dose. So I'm just going to write a reminder. So it's exactly 21 days from today, and make sure that when you leave that you set up that appointment with reception up front, okay? So I'm gonna write it down here. Front and front. Wonderful. Well, here you go. Here's your vaccination card. Really cool thing is that if you go to Krispy Kreme with this vaccination card, you can get one free donut. So make sure you take advantage of that. All right. So now that you've had the vaccine for a little bit, I'm going to go ahead and do my secondary exam so that we can compare, okay? All right. So I have the light again. It's going to be a little bright as before, so just go ahead and make sure that you're concentrating on my nose, just there. Okay. Just right here, okay? Keep it right there. Good, good job. Okay, now the other side. I know, eyes are watering a little bit. Just blink a few times. Okay, concentrate again on my nose. Good, 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 good. Good job. Good job. Okay. Good. You're doing wonderfully. Okay. Wonderful. Alright, so I don't really see very much difference, which is wonderful. So, once again, I'm going to listen to your heart. Alright. Just push aside your shirt for me, please. Once again. Again, it's going to be a little cold, okay? Nice, strong, healthy heartbeat. Great. Feels a little slower now, which is wonderful. Okay. Not as nervous. Yeah. Great. I'm glad. Okay. Alright. So, as before, I'm going to reach around just to listen to your lungs, okay? Now, do me a favor and take a deep breath in. And a deep breath out. A deep breath in. And a deep breath out. Deep breath in. And out. Wonderful. You're doing beautifully, okay? So let me reach around for the second lung, okay? Deep breath in. And breathe out. Deep breath in. And out. Deep breath in. And out. Wonderful, wonderful. Well, You seem absolutely healthy to me, which I'm very happy about. While there, of course, are always going to be people that experience side effects, it seems like you're perfectly healthy. There doesn't seem to be any evidence of an allergic reaction. So now let's take some notes, just for the sake of consistency here. It seems like everything is exactly right. The heart rate was a little lower, and I think that's just because you were a little less nervous. Okay, in terms of what you can expect moving forward, typically from experience, from anecdotes that I've heard from other people, after the first dose, you may feel fatigue, a little bit of tiredness, your arm may be sore. Typically, these symptoms last for about 24 hours. A lot of people report that they don't feel anything after the first, but it is not uncommon to feel symptoms of fever, body aches, soreness, chills, etc. So if you feel any of this, just know that it is your immune system kicking in, and you know that the vaccine is working. It's nothing to be worried about. Typically, the reactions after the first dose aren't as severe as people report after the second dose. Personally, after the first dose, I was just tired, but after the second dose, I felt like I had a fever, I had chills. But for me, it only lasted 24 hours, and that seems to be a common thing between all the people that I know that received the vaccination. So just letting you know so that you don't freak out in case these things happen to you. Of course, this is a 2-dose regimen, so people are not fully vaccinated until 2 weeks after their second dose of the vaccine. So at this time, I would ask you to remain cautious, of course, when you're going out in public, when you're speaking with people that are not part of your immediate household. Continue to wear a face covering, a mask, double mask if you can. If you don't have like a KN95, you don't have access to one of those, it's totally fine. You can always double mask with your cloth masks. I also ask that you remain 6 feet apart from folks, and that you continue to practice good hand washing hygiene. I always love to remind people that there is a correct way to wash your hands. So first, of course, you are going to wet your hands. Use soap always. Soap is actually, washing your hands with soap and water is the preferred method. Even if you've gotten used to using hand sanitizer, it's so much better when you get to actually use soap and water when washing your hands. So if you have the option to wash your hands over using hand sanitizer, I definitely recommend that you take it. So you're going to wet your hands with water, you're going to use soap, you're going to lather and scrub for 20 full seconds. And you're making sure that you're getting all the nooks and crannies of your hands. Make sure that you're getting between the fingers, down here by the wrists, that you're getting the back sides of your hands as well. And just make sure that you're taking the time to scrub for those full 20 seconds, because that is what breaks down whatever unwelcome germs may be on your hands. And then afterwards, you'll rinse for 10 seconds. Dry your hands, turn off the tap with a towel if you can. So I hope that those help. I know it's very simple. A lot of people feel like they don't need to be talked through the process, but most people are not washing their hands for as long as they really need to. So make sure that you're practicing that 20-second rule. Okay? Do you have any last questions for me? Great. Well, it was so wonderful administering your vaccine today, and I hope I get to see you next time when you come for your second dose. So remember, 3 weeks from today, we shall see you back here at the ASMR Pop-Up Vaccination Clinic. Thank you so much for coming. Bye.